Aloha. Thank you for joining us today for today's webinar. My name is Dr. Huidi Xu, and I am here to facilitate today's conversation on cancer care during COVID. So this is a Hawaii Pacific Health webinar event focused on helping provide information to the community, especially cancer patients, as well as those who care and support our cancer patients in Hawaii. Our panel today will provide insight on cancer prevention and screening recommendations, managing cancer treatment during COVID, and working with your cancer care team. So before we get started, I'd like to do some housekeeping here. So first, today's webinar will be recorded. A recording will be sent to all registered participants after the event and will be also available on social media. For those of us who are joining us live, thanks for joining. Please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many questions as we can during the Q&A portion of this event. So I'd like to introduce our speakers today. We're very lucky to have several experts in cancer care joining us today. First, Dr. Jeffrey Colleen. Dr. Colleen has been the director of laboratories at Kapiolani Medical Center for Women and Children for the past 25 years, where his pathology practice focuses on breast cancer and other women's cancer. He has served as the medical director for our Hawaii Pacific Health Oncology Service Line since its inception in 2010. Next, we have Dr. Ian Okazaki. He is the chief of the Division of Hematology and Oncology at Hawaii Pacific Health Medical Group. His clinical practice focuses on cancers of the reproductive and urinary systems, as well as melanoma, which is the most dangerous form of skin cancer. Finally, we have Noelani McGuire. Noe is an oncology nurse navigator who specializes in breast and gynecological cancers. She especially facilitates the Palimomi Cancer Support Group for all cancer types. So let's get started. As everyone knows, COVID has changed our world. And it's especially changed healthcare, and you know, in so many ways that we will not be able to talk about today. But we would like to focus on different ways that COVID affects our cancer community. It's affecting how people are getting screened. It's affecting how our patients are getting treated. It's so complex how COVID has changed all aspects of cancer care. And so let's get started by talking about prevention. And I'd like to direct the question toward Dr. Colleen. And this question is, why is it important for our patients to continue to schedule preventative screening visits?
I think it's important. Thanks for having me here today, Dr. Xu. It's important to continue in that for every reason that it was important before COVID hit us all. But it certainly has caused us to rethink a lot of processes and actually, especially at the beginning, institute some practices that we would have rather not instituted, but just like I'm sure everyone watching this, we were all learning as we go. A lot of questions I get is, well, what about delay in diagnosis and delay in screening? Are we going to be at more risk? Are we going to see more cancer? So I decided to put together, just rather than try to explain it all, a couple of quick little slides just to show what's happened, both in the US and nationally, and worldwide on cancer diagnosis. Just so you can kind of see what we started with and now how we're moving from that. This has not been just a United States issue. In Europe, there's models that are predicting about a 12% increase in deaths due to colorectal cancer, directly related to lack of or delay in early prevention. They are already reporting up to 50% decreases in breast and gynecologic cancers. In the US, I thought I'd show a couple of little graphical things here. That graph on the left is from the metropolitan New York area, and the black dashed line in the middle is about mid-March, when most medical facilities were told they better shut down what we would call elective type procedures. And you can see all of these imaging related procedures, mammography, MRI, nuclear medicine procedures just plummeted down to close to zero. On the right is some data from Florida that's shown in a slightly different way. The tall blue bars are the number of procedures that were done in breast centers a year ago in 2018 and 2019. And then the little orange bars are what happened this year. So you can see again in Florida, just a dramatic drop in the kind of procedures that were done. And this includes screening tests. If you go to the next slide, just to give it a little more local flavor, this is what happened in two of our centers. On the top left is data from our Kapiolani Imaging Center. And what it shows, and this is mammograms, screening mammograms. And you can see that in mid-March, when the orders pretty much went out to shut down these kind of procedures. And again, those were done more for until we got a handle on what we needed as far as protective equipment for our employees, how to create the safest environment for our patients. So that's why things were shut down. And you can see mammograms just plummeted down to zero. On the top right is our Polymomy Imaging Center, and it also showed just a dramatic drop in screening volume. The charts below those show the number of cancers that were diagnosed in those breast imaging centers. And you can see there's a corresponding dramatic dip in the number of cancers diagnosed. It doesn't go to zero because we don't just diagnose cancer by screening tests. We also diagnose them in patients who are symptomatic from in one way or another. So we didn't stop diagnosing cancer, but you can see where the concern is, and which is why we got these levels back up to their normal as soon as we possibly could, which happened in mid-May. So this is just an example of what we dealt with back in the spring, how we responded to it, with the entire intent being that we need to get back to our routine level of cancer surveillance, whether that's breast cancer, colon cancer, and have our facilities available to the public.
That's great. Thanks so much for that information, Dr. Colleen. So what I'm hearing from you is that, early diagnosis leads to early treatment. Early treatment leads to better patient outcomes. And screening is a big part. It's not the only part, but it's a big part of early diagnosis. So maybe my next question I'm going to direct to Dr. Okazaki. And so I guess my question is, where can people in Hawaii get information on where and how to get screened for cancer?
Well, screening I would say just typically occurs with the primary care physician, primary care clinics. And so a lot of that information will come directly from the clinics. And the clinics, the primary care providers and the family practice and internal medicine, et cetera, those practitioners are all well versed in screening. And so if you would certainly check in regularly with your primary care physician or provider, they will actually have you on a schedule for age-appropriate screening. And so typically, a visit to your primary care provider, they'll tell you, hey, you're due for your mammogram or you're due for your colonoscopy. The HPH is well positioned to have resources available online as well, so people can look in and check to see where they can get their screening test done.
Yeah, that's great. Thank you, Dr. Okazaki. So specifically with mammography, mammograms, colonoscopies, I think the HPH primary care doctors are very well attuned, and they measure how well they are kind of meeting goals in terms of how many patients they're sending for mammography and colonoscopy. So it's very high on everyone's mind, I think, in our system. But I think in terms of the patients and what they're thinking about this, I wonder if, do you feel like it's safe to go see your PCP right now? And you know, what is HPH doing to try to keep our patients safe as the patients come to see our doctors?
Yeah, that's a good question, and I'll also preface this with some attention and focus in the cancer centers in general. And please remember that we have 4 medical centers in Hawaii Pacific Health, and which means we have a cancer center in each one. So we have 4 cancer centers, including Wilcox Medical Center, Straub, Kapiolani, and Palimomi. So in this setting, every site we try to have uniform practice so that we're keeping people safe as well as keeping the staff safe. So in general, when people need to come to the clinic, or in this situation, the cancer center, they are screened prior to arrival, and typically it's a phone call to make sure that there's no fever or there's no illness prior to coming to the center. The staff, as well as patients, are also have temperature checks when they actually arrive to the center, and of course there's a healthy amount of sanitizing and cleaning of surfaces and everything that you can imagine, and staff we're always wearing the proper PPE whenever there's patient contact. So from that standpoint, I would say the standard of care is being exceeded at Hawaii Pacific Health, so that everyone stays safe, from staff to patients to caregivers.
Yeah, that's fantastic. You know, another thing that I've noticed about you know, the services offered by the oncology group as a whole, specifically, but also the primary care doctors and other specialists within HPH is the fact that we can offer telehealth options for our patients. And so, you know, what types of opportunities are being, you know, used by our oncology group to interact with our patients by telehealth?
The COVID pandemic actually changed society in general, and I think everyone is now becoming aware or comfortable with using Skype and Zoom and the other we call platforms, where you can actually interact with somebody, whether it's family members or business or medical center, through video. And it didn't take long before the clinics were using it routinely. And the reason that it is being done this way is that many of the you know, question and answer and how you're feeling today, you know, kind of issues can be addressed perfectly easily through video. And so because of that, people are able to stay at home where they're safe, and they're able to interact with their provider easily through the webcam or the video. There are situations where a live visit is absolutely necessary, and in those situations, the patients and their cases are usually triaged so that the appropriate type of visit is scheduled. In cancer specifically, we've been relying heavily on the video visits to actually keep people safe at home who don't need to come into the hospital or medical center and potentially be exposed. I would say that I spend 2 days a week on Maui for outreach, and we've been grounded twice now because of the initial COVID virus and the surge. And in that situation, we had no alternative except to do video visits or virtual visits. And fortunately, and knock on wood, it's worked out well, and we've been able to manage from a distance. I would say that there are, again, certain situations where we have a new cancer diagnosis or somebody needs to get started on therapy. In those situations, we have had patients fly over from neighbor islands to Oahu to get the appropriate testing and even treatment, surgery and treatments started pertaining to cancer. So there, it is a complicated, procedure to determine, whether we can do the video visit this time and maybe a live visit the next time, or whether it has to be a little more involved because treatment's required. A lot of this scheduling relies heavily on our nurse navigators, which NOE has been doing throughout this COVID pandemic.
Yeah, thank you so much. So what I'm hearing from you is that the care provided to our cancer patients at HPH is extremely individualized, right? That our providers, our oncologists, our nurse navigators are really trying to use all the tools available in our toolbox, whether it's in-person visits, telehealth visits, phone calls, emails, however we can do this to get the right level of care to the patient at the right time. And so it's a very individualized process that I think needs to be kind of emphasized here. Just so everybody, I think, understands, I have one more question for you, Dr. Okazaki, about this, which is, for those people who, are just diagnosed with cancer, or maybe don't understand the entire diagnosis right away, or maybe, haven't gone through, let's say, chemotherapy yet. Why are we so concerned about exposure to COVID and in our cancer patient population? How are our patients at higher risk, for instance, when they're going through active treatment?
Cancer in general is considered a risk factor or high risk factor for the COVID virus, and the reason that is not necessarily the exposure and contracting the virus. It's actually the effects of the virus on the body. So it is harder to fend off the virus, and people will get sicker and will at higher chance of requiring hospitalization and requiring perhaps critical care with underlying cancer. So there are data showing that folks with underlying cancer with COVID don't do as well as somebody who does not have cancer. Secondly, for our treatments, not all treatments, but many of our treatments do suppress the immune system. So the immune system goes down. It may be just temporary, but it goes down. And during those periods, if there's a virus of any type, including COVID, then it's harder to fight off the effects of the virus, and people, again, get sick, and they have a harder time recovery. So most of the oncology patients actually have the high risk features, and they have multiple other risk factors in addition. And you can just name them: blood pressure, diabetes, and age. So a lot of our patients have multiple risk factors. That being said, it's really important to keep people as safe as possible when they're going through their evaluation, workup, diagnosis, and treatment for cancer. And we have to be very conscious of when people come into the center. If they do come into the center, how do we keep them as safe as can be? The nurses and the staff all they can max out on PPE if the situation is appropriate. In general, we routinely have mask and face shield and gloves, and the goal here is to keep everybody safe, staff as well as patients. One more point I'd like to bring up to the audience is that cancer care is not just diagnosis and treatment of cancer, or chemotherapy, or immunotherapy, or biologic therapy. A lot of the advancements in cancer come through what we call clinical trials, or experimental treatments that advance the field of oncology. And I think when you see Dr. Colleen's slides and Dr. Shu's introduction, everything came to a standstill when the COVID first hit, because we had to stop everything to make sure that we can reset safely. And that was true of clinical research as well. And so there was a brief pause where clinical research came to a halt, but then quickly federal government as well as state and local institutions were able to formulate plans so that clinical trials can proceed. We have what's called good clinical practice, which is essential part of clinical trials, and the PPE standardized across these studies. And of course, study staff. It's very intensive relationship between the patients and the study staff when they're in clinical trials. So with HPH included, we were able to have a very brief pause with clinical trial participation just so that we could reset and restart. And we have since recovered, and a lot of our patients are benefiting from clinical trial participation. And I think we're catching up, and not up to or maybe beyond where we would otherwise expect to be. So all those safety measures are critical, though, for patients, particularly during cancer care.
Yeah, that's fantastic, Dr. Okazaki. It seems like HPH is doing a lot to try to focus on the safety of our patients, and so I'm very thankful for that. I want to just say one more thing about this, which is that safety for the patients is not only focused on what happens in our clinics and our hospitals, but we really need to partner with the patients and their families. And our patients and families at home really need to be very vigilant and very careful about exposures and behaviors at home, which I think can be risk as well, right? Now I'd want to change gears a little bit. I want to go back to Dr. Colleen to just make some points about cancer surgeries, right? Cancer surgeries, well, surgeries in general at hospitals throughout the country have been down in terms of numbers, frequencies. What's your thoughts about this, Dr. Colleen, in terms of, whether cancer surgery should be delayed because of COVID or not?
This was a big concern of ours because just like what I showed with mammography and imaging kind of procedures, surgical procedures to a large extent started to go down. People may have heard about the term elective surgery being delayed or canceled. From the very beginning of this pandemic, from our health system perspective, and especially from our oncology programmatic perspective, we do not consider cancer diagnosis, surgical treatment, or management as an elective procedure. So we made sure that kind of edict of canceling elective surgery did not apply to cancer surgery. Now, at the same time, multiple surgical organizations around the country that deal with cancer did come up with guidelines, again, depending on the kind of the local situation, usually related to the supplies of personal protective equipment, of what kind of cancer procedures might be able to be delayed or treatments altered in such a way to essentially gain some time to build up that PPE supply without compromising anything on outcomes. So in certain cases, for example, a breast cancer patient who might initially go to surgery could be placed on hormonal therapy, which would also be part of the treatment, with the surgery occurring slightly later. So anything that we did to change scheduling regarding cancer surgery was done strictly based on protocols that have been shown in the literature to not affect patient outcome. But for the most part, 80% of our cancer patients, the surgery is the first therapeutic intervention. And so we wanted to make sure from the beginning that those surgical services were maintained. There was a lot went into that, but I think we were pretty successful in not causing delays.
Yeah, that's really encouraging, Dr. Colleen. There's so many things that have to be done to prepare for surgery and after surgery, as well as, let's say, chemotherapy or biologic therapy with the oncologist. And so there's a big need in this area for care coordination. And so now I'd like to change gears and move over to Noelani McGuire, who is a nurse navigator. And at Hawaii Pacific Health, in our oncology area, we have nurse navigators who really help, I don't want to say, smooth the path kind of for our patients through this very complicated system. And I'd like, Noelani, if you could talk to us about what a nurse navigator is and what the role of the nurse navigator is for our patients here at Hawaii Pacific Health.
Sure, absolutely. So first of all, we have nurse navigators at each of our sister hospitals, all four that Dr. Okazaki had mentioned. And nurse navigators, our primary job is to help guide you through the healthcare system, because as most of us know, it can be quite overwhelming. And that faced with a new cancer, it just accumulates. So we here at Hawaii Pacific Health feel that no one or no family should have to go through this journey alone. So a nurse navigator, really, we'd like to meet with the patient as close to diagnosis as possible. And we're there step by step, initially through the treatment, and even when treatment is done, through their survivorship. So we're kind of in between. We provide a lot of services. It's a team effort along with your oncologist, sometimes your primary care physician. We also have your social workers, oncology liaisons, and we can help with so many things. We help outer island patients, we help patients in the whole Pacific Basin. So we do have a couple of patients from American Samoa, in which Dr. Okazaki had mentioned the televisits. So because American Samoa still have restrictions on traveling, he was able to facilitate the care in that way, as well as communicate with the hospital. So majority of stresses or stressors that come about through cancer can be very, very overwhelming for the patient as well as the family. So we do look at it as a whole.
Yeah, that's fantastic. There have been a lot of financial concerns of our patients, I believe. The pandemic has led to obviously a lot fewer tourists here in Hawaii. And with the fewer tourists, the economy is not doing as well. People may not have the same income as before. So what is HPH doing, to help our cancer patients during kind of this very difficult time financially?
So that's a great question and very common. Hawaii Pacific Health does have a financial assistance program in which each patient is welcome to apply. It is financially driven. There are a multitude of organizations out in the community. The drug companies assist with providing assistance with paying for their medication. It's pretty robust, and as navigators, we have our team that will actually look into each individual's needs, if you will. So when we meet with them, we will assess and find out their needs. Some might need transportation, and so we're able to assist with some transportations, although American Cancer Society is currently has ceased their program at the moment, but they're also had transportation, but we do our best for that. I just want everyone to know that HPH has a specific cancer needs line, which is 643-HOPE. And any cancer related questions, it's prompted and it'll come directly to a navigator.
Yeah, that's fantastic, Noe. There's a lot of patients that we see on Oahu who need to travel in from outer islands and go back and forth for specific treatments as well. And so, so this can be obviously very difficult with the testing requirements, associated with travel between the islands. What kind of assistance do we have at HPH for these patients who are trying to get to the right place to get the right treatment, but may have difficulty with the process?
Dr. Okazaki?
Yeah, either Dr. Okazaki or
Okay, well, so the answer is no, So actually, so we work closely with the navigators and others. It's just really clearly, as Noe outlined well, a coordinated effort, and it's rather complex. And what we try to do is minimize that complexity for the patients and their families. In general, it's testing coming in and testing coming out. I think that's the bottom line, and because it's safe to come in and then safe to go home. A lot of the concern in our state is that Oahu has the highest numbers, per day. And when going back to the neighbor islands, the risk, of course, is transmitting that back to the neighbor islands. So the testing going out is just as important and keeps the neighbor islands safe as can be.
Yeah, thank you very much. I think we are about 30 minutes into our webinar, and so I want to thank all of our speakers today for providing their insights and their experiences in cancer care for our viewing kind of public. Now I think we can move into our question and answer session. I think for the next few minutes, we can start talking about some of these questions. Some of them were submitted by viewers before this event, but some are coming in kind of as we speak. And I'm trying to choose some that I think there are some themes that I seem to sense as I read through some of these questions, and some of them are very similar. So there's one I'd like to direct towards Dr. Okazaki. And I've seen a few questions that are similar. For instance, this one says, I'm 4 years out from a cancer diagnosis. I have no other type of medical issues like high blood pressure, diabetes, etc. Am I still considered at risk?
That's a really good question. In general, that depends on cancer type. There are some really hurdles beyond which we consider the cancer recurrence to be unusual, if not, patient would likely be cured. In those situations, then the cancer risk is like the general population. I think the closer you are to finishing therapy of any sort, there would be a higher risk. And then as time goes by, if you cancer free and as a survivor, that risk goes down.
Yeah, that's great. Next question. There are several questions regarding the theme of nutrition and diet. What's the best nutrition? What's the best diet? So I'm going to direct this one towards Noe. So what do you recommend as the best nutrition and diet to take during cancer treatment?
Well, I think that's specifically for nutritionists. However, there was a nutritional online service that they had. I'm hoping they'll have it again. And correct me, docs, if I'm speaking out of line, but I usually tell the patients plant-based is best, minimize any processed foods, fruits and vegetables. If they are using fruits and vegetables, ensure that they're cleaning it very well. Hydrate as best as you can. And it's, a lot of patients, they just don't want to eat at all. They kind of lose the taste. Their taste buds may diminish. There's drinks that they can take, but definitely here at Hawaii Pacific Health, we do connect them with a nutritionist with the onset of their treatment. So they will specialize their diet specific to maybe their diagnosis and what's going on with them, taking into account maybe their BMI and all those kinds of things.
That's great. That's wonderful. Here's a question that came up, I think, earlier before we actually went on the air today, and I think it's rather timely because of the recent announcement, I think yesterday, that there may be a vaccine for COVID coming in the near future. I guess the question is it safe to get a COVID vaccine while undergoing chemotherapy? Maybe you could expand upon that, either people undergoing chemotherapy, maybe cancer patients in general. Is it good to get the COVID vaccine kind of as soon as possible? What do you think, Dr.
The answer is going to be yes. I mean, I think the COVID vaccine, when it comes out, will have been properly vetted. And you have to realize that the news that you hear now is a result of a phase 3 trial. I mean, it's a mature trial. Thousands of patients have been enrolled and looking for not just effectiveness, but also safety. So when that gets FDA approved, that means that it's passed muster and it's going to be safe. During chemotherapy, now I'm talking traditional chemotherapy, in general, the immune system is blunted a bit, not eliminated, but blunted. And so the immune response to the vaccine may not be as robust or as as good of a response as you would like if someone were not getting chemotherapy. But nonetheless, we do try to time the immunization so that it's given in between cycles or treatments so that it gives the body the best chance to respond. There are folks who are actually even more suppressed because they have perhaps a hereditary immunosuppression. They have a hereditary immune deficit, or if you've, for example, had an organ or bone marrow transplant, those folks are chronically immunosuppressed and sometimes have very little immune response. And so immunizations in that situation depends on the vaccine. You would perhaps want to wait until the immune system recovers a bit before you do it. And also you have to be very careful about the type of vaccine you get when you're that severely immunosuppressed. So in general, the flu vaccine is safe and should be had because we're right in the middle of flu season. And once the COVID vaccine comes out, it's going to be released gradually, and there's going to be a kind of a stepwise prioritization of who gets immunized. But in general, we're going to try to immunize the largest part of the population as we can.
Yeah, no, I think we're all really excited about the possibility of a vaccine coming very soon. So thanks very much for that answer, Dr. Okazaki. There's a number of questions that have been submitted about safety. Safety, is it safe for patients to come to get treatments at the hospital, for instance? So I'm going to direct one maybe to Dr. Colleen here. So the question is it safe to get colonoscopies during COVID? How can we be sure that the personnel kind of around, the colonoscopy, how can we be sure that those personnel are COVID free?
I think the shortest answer would be say that yes, it is safe. The procedures that Dr. Okazaki and Noe have talked about have now been in place for some time at all our facilities. Just like all other medical centers across the country and the world, we're learning more all the time about what's the best practice, what's the best safety environment. But we do not want to restrict access to any patients. We feel like they're safe in our facilities. We've of course instituted many of the things that you've seen at a lot of other places, distancing, wearing of masks, cleaning of surfaces. I would say that early on, we wanted to monitor this at our facilities just to see if infections were being picked up within our facilities. And we did a lot of kind of surveillance antibody testing of our employees. And basically what we found is amongst the hospital employees that the rate of COVID positivity was no greater and actually less than in the general population. And so what that tells us is that the safety procedures we're using are protecting our employees, therefore protecting our patients that are coming to interact with our employees. So I think that's something that people can be very comfortable with, that we have procedures in place for both their safety and the safety of our employees.
Yeah, no, thanks for that very detailed answer, Dr. Colleen. I'm able to see some interesting data that gets put out at HPH on a weekly basis. So I get to see how many of the patients that come through our hospitals test positive on a weekly basis, and it turns out our percent positive rate in the hospital right now is actually lower than the percent positive rate of the symptomatic people in the community. So I feel like the levels kind of in our facilities are very, very, very low right now.
Weedy, if
and
I may, Weedy, if I may, I think it might be helpful if you just spent a few seconds just um, promoting my chart, because I think that's the best way for folks to stay connected with their providers, number one. And of course, the very basic thing, but the most safe thing that we can all do is, of course, wear masks and keep our hands clean.
Yes, thank you for that, Dr. Okazaki. Yes, so my chart, my chart is our patient portal for our patients to interact with our healthcare system here at Hawaii Pacific Health. You can check your laboratory tests. Eventually, soon, you're going to be able to look at your patient visit notes written by the physicians. And it's also a way to write messages to your providers as well. So I'm going to shoot this one over to Noe. I know that on my chart, there's been a lot of interactions between our cancer patients specifically and the nurse practitioner group within the oncology group. Can you tell me a little bit about how that virtual clinic is kind of working?
Sure. So a patient is able to ask a question to any of our oncologists, and we have nurse practitioners at each entity who will actually take those questions, answer them in a day, 24 hours, I believe. And so it really helps the patient because they have their answers sooner. They're qualified, definitely. They work alongside with each oncologist, and the oncologist actually is able to kind of be able to see more patients, and they're on top of it. So my chart is excellent for everyone involved.
Yeah, so that's fantastic. So if as a patient, if you don't have access to my chart right now, you can actually download it from the App Store onto your cell phones, and then work with the clinic, whichever clinic you are, integrated into within HPH. Work with your clinic to get a sign-in code, and that'll get you into the system, and with the ability to do all of these things that we just discussed. There's another question coming through that just came through. I just want to go back to you, Noe, about, can you explain, please, a little more about what the 643 Hope line is all about?
Sure. So 643 Hope is specific for any cancer need. So whether it could be symptomatic, it could just be where's the nearest support group, or what's an online resource that's available. It's anything related to cancer. So where can I get a mammogram? Where can I get a colonoscopy? Do they need a PCP, or they're looking for a oncologist in a certain area, or someone who's going to go to the mainland, relocating? It just could be something general, could be something specific, but that's a number you want to call, 643 HOPE.
Yeah, thanks very much. So I think that might be a nice place to tie things up. So so I want to say thank you to all of our panelists who took the time today to provide their insights for our viewers and patients watching at home. We hope that you were able to take away some helpful information regarding cancer prevention, cancer screening, the treatment options, and working closely with your HPH cancer care team. As you've heard throughout today's program, HPH offers comprehensive services that can support the medical needs of yourself and your family, from virtual care to video, phone, or in-person visits. We are all here to keep you healthier. So if you have any further questions regarding our services or today's webinar, please visit hawaiipacifichealth.org. Thank you very much for joining us today, and we hope you stay safe and healthy. Bye-bye.